I heard this story once from a dear friend of mine where their child spent 5 days in the ER. The child was talking about suicide at 8 years old. Their father had killed themselves. And so it was too close to this child. It was so young. The mother didn't know what to do. And there weren't resources to immediately put that child in an age-appropriate facility or with services. So they lived in the ER for 5 days. It's no place for a child.
I had a 14-year-old patient before the pandemic in 2017 who had a mental health condition. His child psychiatrist retired, and when they tried to find help, it took 4 to 6 months. So as a primary care provider, we tried to help them, but we could not refill his medications. Those Medicaid wouldn't pay for it. We weren't familiar with them. And so instead, we just helped him to get an appointment sooner. During that time, though, he had an exacerbation of his disease, and he got into a fight in a parking lot near my office. And during that fight, he had a gun, and he shot and he killed somebody. That could have been prevented, and that really was the reason why we started looking for a solution, and that is how VMAP began.
100% of our localities are mental health professional shortage areas. That is just all mental health professionals for all people. That mental health workforce shortage is even worse for children seeking care, and those child psychiatrists are very challenging to find in most areas of our state. Most of our localities do not have a child psychiatrist.
I don't have a psychiatrist in the 3 counties that I cover. It's me. I don't have a pediatric subspecialist, it's me. So when you're a rural medical provider, it is you. You are the one-step shop. And if you're going to refer to a tertiary care center, it's not just a pick up the phone and send somebody down the hallway. You have to triage, begin your management, and sometimes do more than just that initial management. It is a matter of sometimes life and death, but more often than not, it's a matter of really good care.
Yes, I can diagnose, I can prescribe medicine, I can recommend, okay, these are the treatments you need. But if we don't know what their resources are and where they are available, whatever treatment plans we make may not work well.
I do telemedicine in Northern Virginia, and even though you would think that that area, because it's such a dense population, that there's an abundance of child health professionals, there's not.
If a family needs outpatient therapy, they might have already called all of the agencies in their community and they're getting the same answers. Oh, we don't accept your health insurance. Our wait list is 6 months long, and the families feel like they've exhausted all of their resources. They feel like they've exhausted all of their options. They're trying desperately to get their child the services they need, but they're just being turned away. And at a certain point, they feel like they're doing something wrong, and so then they just retreat back and then they stop asking for help.
Pediatricians and family physicians, nurse practitioners, PAs, we aren't trained to manage mental health conditions as deeply as we need to with the behavioral health workforce. And so with VMAP, what that allows us to do is to take care of the kids right in front of us immediately.
Our goal with VMAP is that anybody who walks into their primary care provider's office and they have a behavioral health concern is going to get identified and treated in that primary care office. We're not limited and siloed like a lot of the other systems.
So first we have the VMAP line, and then we have VMAP education. Both of those are meant to increase the provider's ability to manage the mental health of their pediatric patient. The VMAP line has on-call child psychiatrists, other licensed behavioral health professionals, and care navigators who can help families connect directly with resources. Those child psychiatrists will call a primary care provider back within 30 minutes during normal business hours all week long. And it's also going to be a child psychiatrist who is familiar with their community and their region of the state.
We often see primary care providers call the line when they know a patient needs outpatient psychiatry, but they know the wait to get an appointment is going to take months. So what they can do is they can call us and they can request to speak with a psychiatrist on how they can help the family that is sitting in their room at that moment, while at the same time I can connect with the family to get them those outpatient services in place so that once that crisis has been mitigated, they can be on the road to recovery.
The other component of the program, which is our education, we are taking this primary care workforce, knowing that we don't have enough behavioral health specialists, and training them in behavioral health and mental health management so that when they traditionally or historically would maybe just refer a patient to a wait list, they can now start to manage that mental health themselves.
Really, our mission within VMAP is to educate anyone providing care to children who also are prescribing.
I will tell you that the REACH VMAP program is the single greatest continuing medical education program I have ever participated in. It not only transformed my care, but it also gave me a breath of fresh air to realize that I was where I need to be.
This program is something that I would call like a force multiplier. I was in Special Forces, and when we were sent into a place, your whole mission is to help people, enable them to accomplish things that they normally wouldn't have. When we looked at the landscape throughout the Commonwealth of Virginia, we knew that, we're really shorthanded in psychiatry. Instead of complaining and talking about all the things that we don't have, what do we have? And so when I was first briefed on this program, I was like, wow, this is exactly what I think we should be doing. Let's lean into this.
I mean, the simplicity of it and the beauty of it is just really remarkable. You do not have to increase the number of psychiatrists, but you take the providers that you have where they are and increase their capacity and their knowledge to be able to provide for the problems at hand.
These resources are here for you. They're designed for you, and they're available for you and your patients. It will make a big difference in your practice. It's free for you and easy to access. And if you find when you're using it that you need something else, tell us and we'll go fight for it, because we're fighting for you and we're fighting for your patients. This puts doctors at the center of redesigning healthcare so it works better for you and your patients.
The thing that I find most rewarding working at VMAP is to see these families reclaim their agency and know, oh, no, I'm doing the right thing. I'm asking the right questions, and I know what's best for my child.
VMAP is doing much more than its mission of just managing mental health for kids. We are actually managing mental health for the whole family, and that's way more impactful.
We do have a plan in place where we are actively expanding this program into maternal mental health. We call it VMAP Moms Plus, and we're very excited to be able to equip our primary care providers to be able to treat women before they are pregnant and while they are pregnant for their mental health concerns or their substance use concerns.
Moms who might be suffering from postpartum depression, postpartum anxiety, when pediatricians see them in the offices with their new babies, we might be able to help.
There's a lot of people that are behind the scenes making this happen, and they put a lot of thought and heart into this. So it takes an army of people who care because they know the difference that they're making. So I'd like to say thank you to all of them.
A mother came up to me and said, I think VMAP is working. And I said, well, how do you know? And she said, I have two kids. One is 24 years old now, and she had anxiety and depression as a teenager and still does. And when I went to my pediatrician back then, they didn't know what to do. They just referred me for care. And it took over a year for this child to get care. And the parents had to do it. And eventually she got the services she needed, but it took a long time. And then the mom said, I have a 17-year-old now who also has anxiety and depression. And I went to that same pediatrician. And now that pediatrician knew exactly what to do. And I got help right away for my son. And I couldn't be more grateful.